Hi, my name is Dr. Caroline Gibbons. I am a CommuniCare obstetrician and gynecologist at the Boerne Campus Clinic. I'm here to talk to you about lab work and education that you need to get done during your 3 trimesters of your pregnancy. The first trimester starts from conception to 14 weeks. First trimester education is very important, so let's start with that, okay? Weight gain in pregnancy on average is 25 to 35 pounds. Remember, you're not eating for 2, okay? Like they used to say. You only need about an extra 300 calories a day on average. Now, in your 3rd trimester, you will gain about a half a pound to a pound a week. Always remember to wear your seatbelt, even when you are not the driver, okay? The strap goes across the chest, under the belly, over the hip bones, okay? Sexual intercourse is okay unless it's instructed by your doctor to abstain. Please let us know if you are doing any traveling. We do have to give you precautions in pregnancy, okay? There is no horseback riding, motorcycle riding, or bicycling unless it's on a stationary bicycle. Yes, exercise, especially walking, is healthy in the pregnancy. If you have a cat in the home, please do not change the litter box. Have someone do this for you. There can be infectious parasites in cat feces that can be dangerous and detrimental to your baby. No drugs, such as cocaine, heroin, methamphetamines, and marijuana, as well as no vaping or smoking tobacco. There is also no alcohol drinking because we don't know the level of fetal alcohol syndrome with any drinks. Please eat plenty of fruits and vegetables in the pregnancy, as well as drink at least 8 to 10 glasses of fluid a day. This could include water, flavored water, electrolytes, and juices. And of course, don't forget your prenatal vitamin. Please eat lean meats, no raw meat or fish, such as sushi. We limit fish consumption, such as salmon and tuna, to only twice weekly, okay? So no swordfish, no shark, as they are predator fish and they tend to have higher contents of mercury. Shrimp and crab are okay to eat. Deli meat needs to be heated up before consumption. So you can put it in the microwave, 10-15 seconds, snap, crackle, pop, okay to eat, or have it in a panini, eat up the sandwich. No unpasteurized cheeses such as queso fresco from Mexico or soft cheeses like brie. Now, any packages at the grocery store that you do buy should say pasteurized and it should be safe. Now let's talk about your labs. We all will be checking your urine with a urinalysis at every appointment, so please do not use the restroom when you check in. We need to evaluate your bladder, your kidneys for infection, diabetes, dehydration, and preeclampsia by checking for sugar or glucose, protein, and bacteria. Okay? Based on your age greater than 21, we will obtain a pap smear to evaluate cervical health. If you have already obtained your pap smear within the year, we do not need to repeat it. For all ages, we will obtain sexually transmitted infection lab work to test for gonorrhea, chlamydia, and trichomonas. We also test sexually transmitted infections in your blood, such as HIV, syphilis, hepatitis B and C. These tests are mandatory for the state to keep our pregnancies safe from infections. We test your blood type. We are looking for part of your blood that's attached to your blood, O, A or AB, called the Rh factor or rhesus factor, which can be positive or negative. This is an inherited protein found on the surface of your red blood cells. If it's present, it's positive. If it lacks the protein, it's negative. If it's negative, it means that you will need RhoGAM, an injection that helps prevent antibodies from forming if there's a possibility of the blood mixing from the mother's blood and the baby's blood. This will be done at any time you have abnormal bleeding or at 28 weeks. If it's positive, there's nothing you need to worry about. If RhoGAM is not given at those points of time, then if and when your blood and your baby and the mother mix, your blood can develop an antibody that can affect the subsequent pregnancy. We obtain a CBC, which looks at your white blood cell count, your blood level for anemia, and your platelet count. We also obtain thyroid to ensure that a thyroid is normal in pregnancy. Abnormal thyroid levels can affect the fetus. There are additional tests depending on your family history and environmental exposures such as your job. And those can be obtained at that time as well from your current doctor. The second trimester starts at 14 weeks and lasts until 28 weeks. Now, there will be fewer labs to obtain in the second trimester than in the first trimester. Your labs begin with the maternal alpha-fetoprotein, or AFP, and this is going to be obtained between 15 weeks and 20 weeks gestation. This tests for neural tube defects, such as spina bifida. This is a time-sensitive test. The next set of labs is the glucose testing between 24 and 28 weeks. This time frame is when pregnancy really takes over your body. We check to see if your body is having trouble processing sugar, causing you to have diabetes in pregnancy called gestational diabetes. Another test is the CBC. We obtain the test in the first trimester and check again for anemia in the pregnancy, but we also continue to monitor to see if we need to start any iron pills or increase your iron-rich foods. The third trimester starts at 28 weeks and it goes all the way up until 41 weeks. This is the time when the baby has a lot of growth. Remember, if your blood type is negative, 28 weeks is when you receive the RhoGAM injection. The last blood test you must obtain during pregnancy is the STD testing required by the state. Again, it's going to be HIV and the syphilis test. We also check again for the last time your CBC because we are evaluating for any signs of anemia. The final testing we obtain in the office is the Group B strep test, or otherwise known as GBS. This test is obtained between around 35 to 37 weeks. It tests for bacteria that can be found in the vagina that can harm the fetus when delivered through the vaginal canal. Antibiotics treat the infection at the time of delivery. Thank you so much for taking the time to listen to this video. I hope that has been educational for you. If you have any additional questions or concerns, please schedule an appointment with your OBGYN. As always, I wish you a safe and healthy pregnancy.